Thank you. At Adaptyx, we believe the future of healthcare can greatly benefit from continuous biomarker data. We're building a biosensor platform that transforms conventional diagnostic assays into continuous biomolecular monitoring systems. We're a spin-off from Stanford University, building upon 17 years of research from my co-founders, Professors Tom So and Joe DeSimone. We have raised about $23 million in capital so far, and this fall we'll be raising some additional capital to fund some of our human studies. Our first target market is in the management of heart failure patients. By 2030, 8 million Americans will suffer from heart failure, costing our system about $70 billion annually. When these patients are discharged from the hospital, oftentimes they get lost. Nearly 1 in 4 patients return back to the hospital within 30 days. This is completely unacceptable. The standard of care today is for a patient to weigh himself or herself on a daily basis. Unfortunately, this is a non-specific and very much a lagging indicator of acute decompensation. This is a big problem. At Adaptyx, we're building a continuous sensor that measures 5 biomarkers continuously: the electrolytes, potassium and sodium, kidney function markers, creatinine and urea, and the gold standard cardiac biomarker, NT-proBNP. By measuring all 5 of these biomarkers, we enable care teams to deliver 3 really big values to the patient. Number 1 is to safely and effectively titrate GDMT quad therapy. We know the faster we get these patients on the highest level of medications, the better their outcomes. Secondly, longitudinally tracking this data allows physicians to understand and see decompensation happen days to even weeks before it can devolve into acute decompensation. Finally, at about the cost of a CGM, we can offer this technology to almost anyone who needs it. The readmission opportunity alone is about $12 billion, and in addition to that, we have a market for medicine titration and long-term monitoring. Our technology is based on breakthrough chemistry at Stanford that allows us to create synthetic DNA molecular switches that can bind to nearly any molecule that we design for. This is a much more flexible platform compared to a CGM, which is limited to just a few molecules. We've demonstrated this technology in vitro over about 12 analytes, and over the last 2.5 quarters, we've begun our first in-human studies. Beyond heart failure, we're excited to move to adjacent opportunities in cardio-kidney metabolic conditions, hormone dysregulation, and precision drug dosing. If any of you are interested in learning more about what we're doing, I'd be delighted to chat with you. Thank you very much.